One of the big problems that I have with it is that what can happen is that as you're changing these randomization probabilities, let's suppose you're in an extreme situation and you're now assigning 90% of participants to the active arm. Let's say there's just two arms. Then what happens is, if that happens later in the trial, there could be temporal trends that occur in clinical trials, and they do happen, and maybe the earlier patients are different from the later patients. And so all the later patients, or most of the later patients, are getting assigned to the active treatment, but the later patients also tend to be healthier than the earlier patients, for example. And so if you're not careful, you could declare a treatment benefit when it's actually just a temporal trend. And there are ways to try and deal with that, but I would say that's my main concern. I also, though, think like in an unblinded trial, if patients are seeing these randomization probabilities changing, then they get good knowledge of which arm is doing better. That could cause patients who are in the other arm to perhaps drop out or start taking the active drug and changing their behavior, basically. So that can influence the results of the clinical trial.